Hello, I'm Dr. Jean Ballard of Cincinnati, Ohio. I would like to review with you the physiologic progression of fetal muscle tone as an indicator of central nervous system development in the fetus and its use for assessing the maturational age of the neonate. In addition, certain aspects of physical development of the fetus will be discussed. I will demonstrate and explain a standard technique for performing each of the 12 criteria in the score with babies of various gestational ages, from extremely immature to post-mature. Gestational age of the fetus, or of the newly born infant, can be assessed currently by 3 different methods. The first is the mother's menstrual history. An accurate menstrual history, when obtained, remains the best measure of gestational age, but depends upon normal maternal physiology and an accurate and reliable history. The second method is prenatal ultrasonography. The prenatal ultrasound examination is one indirect method of assessing the gestational age of the fetus. Based upon fetal body part measurements, it relies upon normally timed and proportioned fetal growth rates. When performed early in gestation, fetal ultrasound is a highly accurate method of assessing gestational age. As the conceptus is exposed to various intrauterine influences, fetal growth may be affected in a variety of ways. As gestation progresses, fetal ultrasound measurements become increasingly subject to the intrauterine environment. Late trimester ultrasound measurements are therefore fraught with unavoidable inaccuracies as indicators of fetal gestational age. Another indirect method of assessing gestational age is the postnatal maturational examination. The maturational examination, a postnatal indirect method of assessing gestational age, is based upon indicators of fetal neuromuscular and physical maturation. Fetal maturation may be influenced by a variety of intrauterine experiences. Stressful fetal experiences may accelerate pulmonary and neuromuscular rates of maturation while slowing fetal growth. A completely non-stressed fetus may mature more slowly than the average fetus. The same events which accelerate fetal maturation may adversely affect fetal growth. Conversely, those which accelerate fetal growth may delay its maturation. Since certain fetal stresses may occur without the patient's or physician's knowledge, the assessment of gestational age by maturational exam is fraught with uncertainties similar to those surrounding fetal ultrasound examination. Keeping those limitations in mind, one can more fully appreciate the usefulness of both methods of fetal age assessment. To perform the assessment, the most sophisticated of all technological developments is necessary, the clinical observer. When performing tests of neuromuscular maturation, we are making an indirect assessment of brain maturity, which in turn gives us an indirect measure of gestational age. Muscle tone may be defined as the slight constant tension of healthy muscles which contributes to a slight resistance to the passive displacement of a limb. The newborn infant's neuromuscular examination includes an assessment of both active and passive muscle tone. If all newborn infants were normal and healthy, both active and passive tone could be used routinely to assess neuromuscular maturation. Active muscle tone, which includes motility, activity, and efforts at righting oneself, is markedly affected by the states of illness, recent maternal medications, acute perinatal compromise, and level of alertness. Hence, Active muscle tone is not consistently useful in evaluating baseline neuromuscular maturity. Passive tone is useful for evaluating maturational development of the neonatal brain, regardless of the infant's state of alertness or level of wellness. Passive tone may be further subdivided into extensor and flexor tone. The human fetus, lying primarily with limbs extended in the very early phases of development, gradually assumes a progressively flexed attitude. This is true whether development occurs in utero or in the nursery, suggesting that flexion results from maturation of the central nervous system rather than from extraneous compressive forces of the uterus. Flexion overcomes extension as maturation progresses. Development of neuromuscular tone progresses in a caudocephalad and centripetal direction, that is, lower extremity